colleague, Dr. Susan Jewell, has a personal experience with our solution, and she'd like to share that with you as an introduction once we're up and running.
Thank you very much, John. Thank you so much. This was quite an experience. So yes, as John Hanishek has introduced me, I am Dr. Susan Jewell, and my background is in clinical research, medicine, as well as space medicine. So I'm very excited with this particular project that we worked on in the last day and a half, and it's actually called myChainOmics. And what we're trying to do, this is where I'm very excited. I've worked in this area of clinical research for over a decade or so, back in my youth at the National Cancer Institute. So I think this has the potential to actually change and construct a new way where people, anybody, using our own intellectual property. And what I mean by our own IP, my IP, your IP, that is anything that relates to my medical data, my genetic material, or my genomics. Anybody uses that to find a cure, then I will be, you will be, we will be rewarded for it. So, myChainOmics is finding cures, but rewarding the participants. And why I'm really excited about this concept, this new paradigm that we can create potentially, is because in the clinical research arena and in developing drugs, new drugs and therapeutics, it's $1 trillion and more area. And at this current paradigm in this arena, the people that actually benefit financially is the big pharma, it's the medical community, it's the clinical medical communities, the doctors that participate, the principal investigators that participate in this field, but not the participants, not the patients, and not the healthy subjects that they have to recruit in these clinical research projects and studies. So we want to, with myChainOmics, to change that paradigm, change and revolutionize how we see people use our intellectual property, and we can decide who and when and be rewarded for it. It doesn't necessarily also be about money. And I'm going to tell you a very personal story, why I'm really, and we are at our team, so excited about this, because 2 decades ago, and I can't believe it was 2 decades ago, as a young clinical physician scientist working at the National Cancer Institute, I was working on several clinical trials. These were not just your typical patients, these were terminal patients. And not only that, they were the pediatrics, because I was working on leukemia. And if you don't know what leukemia is, it is cancer of the blood. At the same time, I was also working on another project at the UCLA, and that was in HIV. And so these patients were also terminal. And what I found with my own experience, going through this journey as a clinician, as a caregiver, and a caretaker in some ways, was that I had to go through each of the patients who were enrolled into these studies. I went through their own pain. I went through their hopes. I went through not only the patients, the subjects themselves, but their family, their friends that were also part of their lives that they were going through. And one of the common themes that went through my experience through this journey with these terminal patients were, I asked them, why did you come on these trials? Because I worked on specific phases of clinical research in drug discovery, phase 1 and phase 2. And these patients were on phase 1. Why is it important when I emphasize phase 1? Because phase 1 in clinical trials in drug discovery is when you find a potential molecule or some chemical that has potential to have some therapeutic application. Could be a cure, we don't know. Has to go through phase 1. And what you do in phase 1 is that you're only looking at toxicity level and lethal dose. So these patients, and remember, these are pediatric patients, young kids, their parents have to be the one that give the permission. But they still need to understand what they're going to go through. So, to know that you can actually live longer if you didn't go on the trial, why would you go on the trial? These are terminal patients, meaning that they probably only have 5 months or left to live. So the general feedback was, one, I know I'm going to die, so I want to find a cure for others. I want benefit from it. That's one. And 2, I want to live another day. If this drug can give me another day, I will go on it, even though I know I might die early. But on the other side of the coin are the healthy patients. Healthy participants. In clinical trials, it's so hard to recruit healthy subjects into a trial because they don't really get compensated. So I'm excited with myChainOmics. For the first time after 2 decades, and all of the colleagues who have been through this experience with me and those that are still in it, can see for the first time that this concept can change the way that we give back to those that give us, and to find new therapeutic interventions and new cures, not just those big pharmas and the medical community that's benefiting from it. So I'm going to hand it over to John, who's going to continue with the presentation.
Thank you, Dr. Susan. So this is a challenge that's been going on with us for a while. Henrietta Lacks is a famous one. A lot of cancer research benefits from her immortal stem cell line, her immortal cell line, and her family is still trying to get paid. So this is why we have invented myChainOmics. It's direct connection between anonymized patient data and compensation for medical research. We can do this because of the blockchain. So the aspect that's incredible opportunity here is we can have multiple users sharing their data into a connection of a database and a blockchain, which creates unique IDs for them, but does not need to reveal their name and other identifying information. But we need the unique ID, because we need to be able to verify that, 1, this is an actual person, and 2, that we're going to come back to them later to get them paid and also get them access to these eventual discoveries. And now the scale that myChainOmics lets us operate on is global. So for the first time, researchers have one pool of access to clean, high-quality data coming from sources that are getting paid to send it. So they can access and utilize modern advances in AI, machine learning, and pattern recognition to address a whole new scale of data. And they will discover value, right? We already have seen the promise of big data approaches bearing fruit. We have been watching for the last, it's almost been 100 years, using data to derive new cures. But now, for the first time, with myChainOmics, we can close the loop. Prizes, products, whatever, that gets created off of these real people's real information, their IP, their body property, right? They can get a share back, and we don't need to know who they are, but they know who they are, and they know that they're getting rewarded directly as a part of the revenue share of these incredibly powerful and life-changing discoveries. So that's why we're so excited about this. It's going to enable more discovery and more equality in the benefits of that discovery, which is, frankly, the whole promise of the blockchain for us. That's why we care. Massive scale of data sharing, unique IDs to make sure it's real participants and facilitate the rewards. We don't need names, we don't need centralized trust. This can be a global paradigm, and this can still be safe for people participating, both healthy, terminal, ill, or just curious. This is going to be a whole new paradigm for medical discovery, and we're very excited now to give you a brief little demo of what we cooked up here at the hackathon, where you can see how both the participants and the researchers will engage with this system, and how easy the blockchain makes it to send value. So let's fire up our myChainOmics demo here. This has been a really fascinating experience to work with this technology, because blockchain enables us to really connect the dots between the desire to have things be very real, very tangible, but also still anonymized, which has not been possible before. So you see on the right, we have our patient view, our participant view. They can do a few things. It's a very simple application. They can upload a medical record that they already have. Their physician could help them, but remember, you own your medical records, so you can go ahead and share them. They can enter information directly into the app, and the most exciting for us is taking advantage of these modern services like 23andMe to let them upload the entire raw archive of their genetic analysis. Again, giving researchers a huge trove that they don't have to go pay some company for. They're going to pay the person whose DNA that actually is, only after there has been some kind of drug discovery. So we actually integrated that. We took the advice of one of the mentors, and we utilized the principle of, you're not going to upload terabytes worth of data to the chain. You're going to use the blockchain for what it's good at, and you're going to use other services that are already verified. In this case, we actually used S3. So we can encrypt that data and store tons and tons of information, but scrub out anything that's directly related and still create that unique ID on the blockchain. So we're experimenting with hybridized approach here that will enable us to actually work with hospitals and other groups that haven't verified this modern technology, but they have verified the more traditional technology. So on the other side, on the researcher's view, they see, in this case, they're looking at direct genetic information from a 23andMe test. So they don't need to know exactly who this is. They can know characteristics of it, they can correlate it between participants, they can see patterns within it, and when they find a cure, they would click cure. You'll have to forgive the bit of a wizard behind the curtain thing here, where we're going to send Ethereum over this other method, but you will see it reflected on the other side, where this is real money, it's real Ethereum that participants can get. And working out the specific revenue model, percentages, and accounting for this, it will be part of the challenge of fielding this application. But we think that the benefit to even large organizations will bring them to the table to want to engage with how would you be accountable as you do drug discovery and research, because if you can create, as we're doing, a direct connection between sharing information and getting monetary value, we think that's going to bring a lot more information out of the woodwork when the incentive is that clear. So it benefits everyone, and the amount of revenue shared doesn't have to be very big to make it better than it was before, which was nothing. So we want to improve from nothing, and we think we can do that. There you go. Now it's up from 6 to 8. So that cure benefited this person in a positive way, directly. And that's the power of myChainOmics. That's the power of the blockchain. And that's why we're so excited about the new approach of connecting data to value directly, connecting people to insights directly, so that we can get more discoveries and have more value for everyone. Thank you. So any questions?
The first one is, we actually, as you also in your example, you use the 23andMe as a sample data, right? So basically, we do need to verify the data from anybody. So the medical records. For example, we don't want to actually have somebody just manually enter something which is completely made up. So in your platform, so you have to really have a certain way of verifying, hey, these are the right data. The second thing is if we actually given this, then 23andMe is actually is already the platform. It definitely already have lots of people have lots of this data. So if I were 23andMe and I want to have this data, if I get the permissions from the user and they would like to share, I can certainly anonymize my data and share it with everybody. It's just like right now there is already open source projects. Basically, people actually are collecting all this data and really share for the other people to be able to use for the machine learning or the AI, right? So in that case, what exactly, how your platform can really differentiate or add more value to the other platform?
So, two ways to answer both questions.
Yeah.
First question, every app instance is one unique ID. So if that unique ID starts sending a bunch of things which are not valuable, it's pretty simple to do reputation system on that ID. We can enable that ID is no longer sending valuable things, it's spam. There are ways of verifying it. We can work with hospitals and other groups to cross-verify it. But the core for us is that as long as we have the unique ID, we can anonymize it, but still make sure that it's not just disconnected. It's tied to something, which is always the same thing every time, which lets us do that kind of a check to see if this ID is valuable information that comes in, this ID is starting to look suspicious. And we can rank that and do other analyses. And to your point about sharing, we know that data can be shared. That usually goes one way. So 23andMe can share this thing I paid them for to another company, and then that company makes a lot of money. But that's not what we're interested in, because we know that's a solved problem. We're interested in how do the money that's made over there at Pfizer from my 23andMe data come right back to me the second that it happened. So yes, 23andMe could do that. They could, but the thing is that also we're in the blockchain area, so we don't want one platform. We're going to have groups out there. We know this is coming. The synthetic genomics, CRISPR, and home genomics revolution is coming. There will be people who will be able to do, and there already are, open source genomics projects on small portable devices. So the era of the 23andMe might not last as long as they would want it to. There's going to be a whole collection of platforms, and we welcome them. We're building a system that is embedded between all the platforms that lets everyone share all the time. And even groups, for example, other research groups that don't want to send through 23andMe, they can send directly out into this open pool. So we're creating a space that's more of a neutral space, doesn't rely on any single point. That's why we're emphasizing the myChainOmics, the blockchain aspect. We know we could solve this with databases, but we already have many databases, and it's not solved. So we have a strong hunch that we can fill in the gaps between these multiple different databases by utilizing a blockchain approach.
And also, one of the biggest differentiator, adding on to what John said, is you are going to be rewarded as well for your contribution. So that, I think, no one else is really doing out there. And then the clinical trials I work on at NCI, these are government, taxpayers funded. So when you're on the trials, you don't get compensated at all. There's nothing you get back. So when I'm talking about, patients that eventually die on these trials, it's their family that are left over to have to deal with the deceased patient, their loved ones. Maybe if they get compensated in some way, and it doesn't have to be monetary, but we're going to talk money because this is business. So we'll say, get compensated financially for the family. Maybe they can pay for the funeral. Maybe they can take that money and start a foundation for their loved one that they participated, gave something out altruistically to the community and to the world. This is what I think is very unique with the concept that we're trying to construct.
Susan, so the opportunity to add healthy people into the trials, what advantage does that bring to pharma on the discovery of markers?
So it's not just about big pharma. It's really about trying to increase that pool of healthy subjects, the cohort for the healthy subjects, because they are the control in these studies. And, you know, right now, and even 20 years ago.
But the question I'm asking is specifically, if you don't have enough healthy patients as controls, how does that negatively impact the tests
study.
themselves?
Well, then your data is biased. You cannot do a double-blind study because you need that control to be the control arm. You need the healthy subjects as well. You know, because you're looking at new molecules and you maybe just have the potential, but you need to test it. You need to have that healthy cohort arm in all the research studies that you're going to conduct.
Right. So what would be the cost to pharma in those cases if they can't run or go through it? And actually, probably not pharma, it's whoever's working on the drug itself, maybe the biotech. What is the impact to them in terms of their business model?
Well, there's especially in the farmers, right, where they're in it to find new drugs, right? So if they cannot recruit the healthy participants, then that actually is significantly can affect their business because they have to continually develop new drugs, find new drugs, because currently, I think 7 years that you can have a patent on a drug that you discover, then it opens up to generics. So I think it's 7 years still, I'm not quite sure, it's been 20 years since I've been in this field. But when I was doing it, it was 7 years. So you can have a patent for 7 years. After that, it's expired, then it's open for generics. So business model in terms of big pharma, they need to continually discover new molecules that can have potential to be researched, go through the drug discovery phase. So yeah, there's a significant impact. So you need the healthy recruitment, the participants to be part of this paradigm.
I'm sorry, I still didn't get the use case from the research perspective. Internal research. I need access to DNA data through my research. Do I download this data? How are you going to track that I use this data and which data actually contributed to this research?
So when you're looking at genomics, you're looking at the sequence of a person's DNA sequence, their chromosomes. And on the genes, every disease at this point has certain genes that are identified to say that this person, and that's what 23andMe is all about, sequencing your genome, your personal gene, to find what disease that you're high risk for. And there are target genes that have been recognized and identified for each disease. So that's when, for example, leukemia, there's certain genes that actually are the ones identified for you to get leukemia or high risk to get leukemia. So when if you're part of that gene pool, and we can target those individuals with those genes, then we can say, oh, well then that's likely that patient or that person would like to bring as a healthy participant. We like to ask them to come into the study, as the healthy participant. But most people won't want to. You're healthy, why do you want to go in a clinical trial? Why do you want to do that? So here's an incentive for you.
You're explaining that from the user perspective. I'm not thinking the research perspective.
Yes, so that's with me as a researcher. So.
Yeah, so you basically, all the data is available. You can run searches through it. And then for the researcher's perspective, they don't really even need to engage with the blockchain necessarily. They can engage all of the database entries. But the thing is that it's signed by the blockchain so that there's a unique signature that goes to every entry. So they can see, for example, that 20 entries all came from one ID, which means, okay, I know this is the same person. So they can reconstruct profiles even though the data is coming from many disparate sources. And they'll be able to run any kind of searches that they want using kind of analytic type of technologies, like searching through the genomics aspects, and also going directly from the signatures, the IDs. So for example, you could construct a virtual study where you have a patient who you've never met, you don't know, you may not even know where they are, depending on how the data gets anonymized. But every time they come in with more information, you can track them. So it's a way of virtualizing procedures that are done where patients have to come in, but now you can engage with them in a way that, again, it's a unique information, but there can be new things that come in. So also by taking some of the actual heavy lifting off of the blockchain and securing some of the aspects with the blockchain, we're giving people the ability to use more traditional big data metrics to search through the information.
I still didn't get it. I'm sorry. So I'm a researcher. I come to the platform, I download the data, I find the steward to relate to me, and then I say, I'm sorry, I don't pay anything because it wasn't you. I used my own data. How are you going to prove or enforce me to pay for to share the data?
Yeah, no, it's a great question. You know, it's something where the institutions would, there need to be some buy-in to use it. Also, they don't download the information necessarily. We'll do everything we can to have the information be accessed, but not necessarily taken off. And we will do other aspects of encoding that unique ID into the elements of the data so that were audits to be done about the research and the community were to look into it, there would be trails left behind that, no, this data did come from this platform, and if you sign and sign up for the application, you agree that you are going to report that you have done something with this data. So we can utilize the different legal constraints of the regions we operate in, and some of it will be on slightly the honor system, but we're hopeful that at least by creating the ability and making it something that's as simple as a couple clicks, that the incentive will be there to just go ahead and do it, as opposed to now where there's not even a mechanism. It would be very difficult for the researchers to even try to do this if they wanted to. So we're going to remove the friction and allow at least more of this to happen, and then hopefully over time we can push it further and further and further and create potentially a new cultural norm among the scientific community, and then eventually new laws that say that it is illegal to simply use information. And these things have happened before. We've seen the emergence of HIPAA and other things where it used to be the Wild West, and now things have changed, so we're hopeful.
Can you use the DNA sequence itself for a person as a sort of identity for the data?
Yeah, there with any of these de-anonymized systems, there are ways of reconstructing it, and our team would come up with ways of deconstructing it, and there would likely be a cat and mouse game. But the core for us is at least having that, it's a balance between having a unique ID, but still separating obvious things from the users. That would require a lot of effort. So what we're looking for mostly is protecting people from discrimination and protecting them from obvious data breaches. If somebody really wants to figure out who you are from your DNA, you probably have some different kind of enemies. And that is something that's a little bit outside of the scope. However, it's something that the team would always be looking at as that changes.